Hello everyone, this is Dr.Rohit Gupta, author of Keynotes Modern and Classic Repertory and lecturer in the Department of Organon of Medicine in a Homeopathic Medical College. A good news to the lovers of homeopathy and buyers of this repertory, for those who wanted videos of rubric hunting on this repertory, because I received many messages for this purpose. So let's see how it's easy to find a remedy in comparison to other repertories. If you want to understand it, then you have to watch it completely without skipping or forwarding it. First of all, you have to open KMCR, yani Keynotes Modern and Classic Repertory. But before starting it, you must know the fundamental concepts of this repertory. This is based on 122 years old Allen Keynote Materia Medica's revised and upgraded edition KEYNOTES ADVANCE and COMPLETE for the knowledge of medicine. Concept of modern medical science and allied subjects for the knowledge of disease and their characteristics, signs and symptoms to understand their conversion in rubrics and subrubrics. And the method of Organon of Medicine for the knowledge of the best method employed in homeopathic practice guided by Dr. Hahnemann, with colorful gradings in 4 colors which are not only used in medicine but also in subrubrics. Let's start rubric hunting for dengue fever. Now open the contents page and go to the part 2 systemic or particulars section, then choose chapter number 29 clinical. But why clinical chapter? Because all bedside clinical findings and communicable diseases are mentioned here. Now open page number 444 for a clinical chapter, then search alphabetically, or you can go through the index which is started from page number 467 and search alphabetically dengue fever. It's present on page number 446. Here you can see the dengue fever with 6 remedies and 1 subrubric, but 2 remedies out of 6 are present in second grade italic and blue color. These gradings are authentic because these are taken from the textbook of Materia Medica Allen Keynote, which is made on the signs and symptoms of drug proving 10 volume of hearing guiding symptoms. So these gradings of medicines are genuine in comparison to other repertories. So remedies are also authentic in comparison to other repertories, whereas both things are variable in other repertories. So there is no chance of vague grading and vague remedies in this repertory like other repertories. These 6 remedies for dengue fever have similar characteristics and are clinically verified in many patients. That's why these are mentioned here. And it's available with 1 subrubric, sore eyeball, with a single remedy, Eupatorium perfoliatum. For your kind information, this repertory has most of the subrubrics with a single remedy. That's why this repertory required only about 1 to 4 rubrics or subrubrics. So if any patient has pain in the eyeballs under diagnosis of dengue fever, you can easily prescribe this single remedy, Eupatorium perfoliatum. But if you are not getting any subrubric of characteristics regarding remedy written under diagnostic rubrics, then you have to go to the fever rubric in the same chapter, clinical, and search subrubrics or upper subrubric or lower subrubric for the remedy. Note, all diagnostic rubrics are designed under guidelines of acute case taking format by following the guidelines of Organon of Medicine. I will share it in the next video. In rare cases, you have to go for the constitutional approach in those conditions where you would not get any subrubric under any diagnostic rubric. Then open part 1, generals or constitutional, in contents, and go to the related chapter according to characteristic signs and symptoms. I hope you have learned a very easiest and authentic way of repertorization here. Like the video, subscribe to the channel, and write in the comment section what disease you want for rubric hunting. Thank you.